Byerly, University of Kansas Medical Center, talking about a conference featuring exciting research in the Alzheimer's space. So good morning.
Good morning. Thank you for having me.
Absolutely, anytime. Now, the Alzheimer's Association internal conference took place just a few weeks ago, and there's some pretty exciting research that was featured.
Yes, there's a reporting on a landmark new study called the U.S. Pointer Study. This was a study of two-year study of 2,100 older adults at risk of developing memory problems. The goal was to test if lifestyle changes could maintain or perhaps even improve their thinking abilities or cognitive function. Participants were assigned to one of two groups with different levels of support for implementing those lifestyle changes. One group was highly structured. It gave them very specific guidance on physical activity, brain activity and socialization, diet, and health check-ins with their providers. It also coupled them to very clear guidance with professional navigators who held 38 team meetings in those 2 years and allowed them to set individual goals and have follow-up. The second group was largely a peer-led group for team meetings, and so it was largely a self-guided experience for them, and they did also receive education about brain-healthy lifestyle approaches. The results were frankly quite exciting. Both groups showed improvement in overall cognitive performance, and the structured group, as hoped for and anticipated, had greater improvement. So the takeaway was that even modest lifestyle changes can reduce the risk of developing cognitive decline and dementias, and a structured support for that boosts that effect.
Now, any other areas to note in the study that were interesting to you?
Yeah, two of them were quite notable to me. One, as a researcher, I both identified and appreciated the funding source for this study was primarily the Alzheimer's Association, providing $40 million for this phase of the study.
Wow.
The Alzheimer's Association is also providing at least another $50 million for a second phase of the study that will look at the longer term effects over an additional 4 years in the same participants. Another really important thing is that the study included a very diverse population. So more than 30% of the participants were from groups that traditionally don't tend to participate in dementia research. So the results are applicable to our diverse U.S. population.
Now, Dr. Byerly, really quickly here, what are some quick things that people can take away from the study and do at home?
Yeah, so that comes from the structured group and what they did. Physical activity with aerobic training 3 times a week, 30 minutes, resistance training twice a week for 15 minutes, flexibility training twice a week for 10 minutes. For brain activity, they had access to web-based cognitive training 3 times a week of 15 minutes. The diet was a combination of the Mediterranean and DASH diets. And then finally, they had more frequent health check-ins than is standard care in the U.S. So they saw their providers twice a year.
Interesting. Well, thanks so much for coming on this morning. We appreciate it.
Thank you very much.
All right, everyone stick around. We'll be right back with the final look at your forecast.